Good evening, everyone. On behalf of the SingHealth Duke-NUS Global Health Institute, I, Madana Naidu, am delighted to welcome all of you to this 5-part webinar series that focuses on the impact of COVID-19 on health and health inequities in the ASEAN region. As we are all aware, health systems across the world are rife with health inequities that adversely impact different groups of people. ASEAN countries are no different, and unfortunately, when health systems are faced with challenges as daunting as the current pandemic, vulnerable groups are the most impacted. This webinar and the webinar next week on the 29th of July at 7 p.m. will explore this in greater detail. So today's session will explore the existing treatment and control strategies of HIV, AIDS, TB, and malaria in the ASEAN region, and how the COVID-19 outbreak has and is expected to further impact such programs. The speakers will address the likely impact of COVID-19 on mortality and morbidity rates due to modifications of HIV, AIDS, TB, and malaria programs. The challenges of protecting vulnerable populations will be addressed, while exploring opportunities for regional cooperation, alignment of funding, and adoption from a health systems perspective. Our moderator for today is Prof Shenglan Tan. Prof Tang is the Mary DBT and James Simmons Professor at the Department of Population Health Science in the Duke University School of Medicine and the Deputy Director of the Duke Global Health Institute. He's also a Professor of the Global Health at SDGHI and at the SingHealth Duke-NUS Global Health Institute in Singapore. Prof Tang is also the Director of the Research Hub for Asia Pacific Observatory on Health Systems and Policies, or WHO, hosted at the Duke Kunshan University in China. We also have 3 speakers joining us today, namely Dr. Marijke, Chief of Staff, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, Ms. Amita Chebbi, Senior Director, Asia Pacific Malaria Elimination Network, and Dr. S.T. Febriani, TB Technical Advisor from the Lembaga Kesehatan Nahdlatul Ulama. I look forward to the discussions. Over to you, Prof. Tang.
Thank you, Nadia. Welcome everybody to attend this webinar, looking at how COVID-19 pandemic has impacted HIV/AIDS, TB, malaria program in ASEAN countries. Good morning, and to me, myself in Duke, and good evening to everybody in Singapore, Malaysia, and ASEAN countries, and good afternoon for those in European countries. As all we know, the COVID-19 pandemic has resulted in a profound changes, a profound impact on almost every aspect of our societies and on our peoples. It has caused economic downturn in almost every country around the world. Healthcare service delivery in many countries has been overwhelmed by meeting these challenges brought by the COVID-19 pandemic. So we actually really concerned about the effective delivery of HIV, AIDS, TB, malaria, among other health problems. As we probably know, these 3 killer diseases is so important to many peoples. And we all know HIV, AIDS, TB, malaria control program may not be seen as priorities by many health policy makers or Ministers of Financing in years to come because of COVID-19. More immediately, COVID-19 has posed a threat to the continuous delivery of services, medical supplies for these programs. As earlier July this year, about 36 countries reported to WHO about the disruption to services of HIV, AIDS, TB, malaria-related services. Such a disruption could cause actual deaths of these patients. So today, we organize this seminar, specifically look at how the COVID-19 pandemic has impacted HIV/AIDS, TB, malaria programs in ASEAN regions. We are so pleased to have three distinguished panelists with us. So as Nadine already introduced, the first panelist is Dr. Marijke Wijnroks, Chief of the Staff, Global Fund to fight HIV/AIDS, tuberculosis, malaria. Marijke has been with the Global Fund for 7 years, and before her services with Global Fund, she has worked in the Dutch government, the Ministry of Foreign Affairs, responsible for HIV/AIDS and other in the health program. She brought a rich experience of working in many developed countries in these three killer disease programs. The second speaker, the panelist is Ms. Amita Chebbi, as said, is a Senior Director of Asia Pacific Malaria Elimination Network. A lot of experience of malaria control in the region and also working for public-private partnership. The third speaker is TB expert, Dr. Esti Febrana, is from Indonesia, working large NGOs called the LKNU, responsible for the TB control for many district communities of Indonesia, covering hundreds of millions populations there. So welcome all our distinguished panelists today. So first, I would like the panelists to briefly introduce the existing treatment control strategy of HIV/AIDS, TB, malaria from global, regional, country perspective. So first, may I invite Dr. Marijke Wijnroks to speak briefly. Thank you. Welcome.
Thank you very much, and I hope you can hear me. I'm struggling a little bit with the mute and unmute buttons. Thank you very much for inviting me to participate in this panel discussion. I think it's more for the country representatives and technical partners to talk about the strategies in the region. The Global Fund is a funding agency, so we support countries to implement their strategies to fight AIDS, TB, and malaria. We're funding, I looked at the list of ASEAN countries, and the Global Fund is supporting 7 countries: Cambodia, Indonesia, Laos, Myanmar, Philippines, Thailand, and Vietnam. So quite a number of really important countries. And all these countries do have significant burdens of HIV, TB, and malaria. HIV in the region is very much what we call concentrated epidemics, with infections concentrated among key and vulnerable populations, including men who have sex with men, transgender populations, sex workers, and people who inject drugs. TB is quite prevalent in the region, especially among poor and marginalized populations, including immigrants. And malaria, actually, a number of countries are doing quite well, are moving towards elimination of malaria. And we're very happy to support those countries as they move towards elimination. The Global Fund is also supporting a regional project in Asia, which is intended to support countries in the region to eliminate malaria. And that's because there's resistance emerging in the region, I think originally starting in Cambodia, but it has spread in other countries in the region. And we really try to support the region to eliminate malaria so that we can also contain the emerging resistance and not have it spread to other parts of the world. I think I'll leave it at this for now and leave it up to my fellow panelists from country level to talk a little bit more about the national strategies. Thank you.
Thank you. Thank you. So may I invite Amita to talk about malaria as a disease control strategies from a regional perspective. Amita, please.
Thank you so much. It's a pleasure to be part of this really critical and timely conversation. As you mentioned in the introduction, I represent the Asia Pacific Malaria Elimination Network. It's also known as APMEN, and we are hosted by the Asia Pacific Leaders Malaria Alliance here in Singapore. So APMEN itself is a 10-year-old regional collaborative network that was set up in 2009 to focus attention and energy on the issue of malaria. And today we have really evolved to be a fairly broad network consisting of 21 national governments that are represented through their malaria programs, as well as 50 partner institutions. A core focus of APMEN's work is to really support the exchange of technical expertise, between national malaria programs, and really facilitate capacity strengthening through country-to-country exchange and peer-to-peer collaboration. The story of malaria elimination in the region really received an impetus in 2014. This was at the 9th East Asia Summit when the ASEAN leaders committed to a goal of a malaria-free Asia Pacific by 2030. So that was really a milestone defining moment for all of us here in Asia Pacific with respect to malaria. We had a goal that we wanted to work towards. And over the last few years, we've seen that all countries in the region now have developed very specific national strategic plans that are targeting elimination by 2030 or earlier. Several countries have also set up national level task force that are broader than health to really bring about a whole of government approach to this problem of malaria in the region. And as a result, over the last 5 years, we've seen an increase in investments made through national health programs on malaria itself. So just to give you a flavor of the numbers, the domestic financing for malaria, which is the funding that's available for malaria programs through their own national budgets, has almost tripled since 2012. And we've seen a corresponding decrease in malaria cases to the extent of 31% since 2012 just in the region. So a lot of good progress made. I do want to highlight a few success stories, I think, which are really close to us here in the region, particularly with respect to elimination. Malaysia is part of the E2020 club. So this is a group of countries that are hoping to get certified as malaria-free by the WHO this year. We have Cambodia that has not reported any malaria deaths since 2018. And of course, we have Singapore that was declared malaria-free in 1982. But alongside this, I think, as Marijke mentioned, there's been the threat of drug resistance, which has really threatened a lot of the progress that we've made in the region. So a few years ago, along the Cambodia-Thailand border, there were some cases of falciparum malaria that were detected, which were resistant to all available anti-malarial medicines. And this was a very serious issue because if the drug-resistant malaria spread across the region and beyond, it would threaten a lot of the global gains that had been made so far. So the Global Fund really provided a lot of significant investments to national programs to address this risk of drug resistance. And I think we're now entering into the third phase of that support in 2021. It's fair to say, I think, that the challenge of drug resistance has significantly reduced. I would hesitate to make a more emphatic statement at this point just because of the current coronavirus situation and the impact that has, and look forward to discussing later in the program today, what are some of the mitigating steps we can take to make sure the progress we've made is protected in the coming months and years ahead. Thank you.
Thank you, Amita. I'm pleased to hear this region has made significant progress in terms of eliminating malaria. And there are lots of good stories. And of course, we still face challenges in terms of drug resistance in malaria control in many of the countries in this region. But I'm sure there are more challenges, more serious challenges in TB control in the region. So let's hand it to Esti talking about national TB control strategies, the challenges in Indonesia. Esti.
Okay, thanks, Prof Tang. Good afternoon, everyone. Thanks for inviting me as one of the panelists to talk about the impact of pandemic COVID-19 to TB program. And I will talk about from the country perspective. As one of the countries with the high TB burden, Indonesia now is facing the higher burden due to the pandemic COVID-19. Actually, currently, generally, we are in the phase of transition to the new normal after applying the large-scale social restriction regulation. For TB, we are now in the process to prepare the concrete planning and adjust the program planning and all of it funded by national, local, district budget, and also donors, including Global Fund, USAID, and other donors. And currently, around 50% of PMDT hospital, the drug TB resistant hospital, referred hospitals, are being a referral hospital of COVID-19 is one of the problem in our country. So, but the TB program must be ensured the patients keep to continue the treatment until cured. And that's why we have facing the big challenges how to keep ensuring the treatment adherence of the patient and the prevention strategies to protect the patient to get infected already developed, included how to make the TB patients to get strongly advised to limit outside activities to avoid the possible exposure to the virus that causes COVID-19. And if the patient needs to visit hospital or having outside activity, they must use the protection or the surgical mask. And Indonesia now in the phase of process to provide only oral regimen for the RTB patient, but it will be implemented gradually. It was considered to the RTB patient and condition and also the availability of the drugs. And this condition is other challenges for the RTB patient who need to visit hospital or primary healthcare facilities in daily basis for getting the treatment. So if we want to talk about what's the vulnerable people that get impacted from the pandemic, and I will talk is I think that the DRTB patient is getting greater challenges in accessing the health facility. And later on, we will talk more about it and how the national program already in progress to resolve and to face this problem.
Thank you, Esti. Okay, then we should move to the second question, the impact, the ongoing impact of COVID-19 on HIV/AIDS, TB, malaria in ASEAN countries. So may I invite Amita? You first talk about what you have seen or have your observation about impact of COVID-19 on malaria controls in the regions.
Yeah, no, thank you. So, I think to just frame a bit around where do we find malaria in Asia Pacific these days, as you all know, malaria in the region is really becoming invisible. It's not a disease of our capitals. It's not in the urban centers. It's really receding away, to the border areas. And that's where increasingly you find malaria is being concentrated in the Asia Pacific region. So where you find malaria today is really among, mobile migrant populations, your forest goers, hard to reach vulnerable communities. So I want to paint a picture a bit here, I think, of a person who's really at high risk of malaria in the region. So this is a typical forest goer. You'll find him on the border along, Cambodia, Thailand. He's a forest goer, and so he, goes into forest for his livelihood, which is really to collect firewood. Sometimes, maybe some illegal logging. These forests are, they're very dark, dense in the monsoon season, which is when, you're at the highest risk of malaria. These are really wet areas, very humid. And typically people, these forest goers, they go into the forest for extended periods of time. So it's not really a day job where you go in the morning and you come back in the evening. So most of these forest goers, they spend extended periods of time within these forests without any access to healthcare. Several of these forest areas are also conflict zones. So, it's really a picture of a geography which is beyond the pale of the normal formal healthcare system. They don't have access to regular healthcare services, and they really depend a lot on community support. So in such a setting, we can't expect our normal malaria control interventions to work. So like I said, we don't really have regular health posts in these settings. They don't have access to, regular diagnostic and treatment services. And even when you think about vector control, the way you control the mosquitoes, one of the most commonly used interventions for vector control is insecticide-treated bed nets, right? But for these forest goers who are spending extended periods of time within the forest, then the bed nets are of no use. And so this has really given rise to, I think, a lot of innovative models of trying to access these hard to reach populations. So the first one is really around the role of civil society organizations in this context and how do they reach these vulnerable populations. So in the Greater Mekong sub-region, we have a very critical platform called the Regional Malaria CSO platform that was again set up with support from the Global Fund. And it works across 5 countries and is a network that brings together community-based organizations, civil society organizations, and really people who are on the front lines of providing access to treatment and services for these vulnerable populations. The second piece, I think, is just around some of the innovations that have developed here around accessing these vulnerable communities. So I talked about vector control and the fact that bed nets don't really work. So what has now been developed is insecticide treated hammocks. So these are really hammocks that these forest goers use. They tie a hammock between 2 trees and use them at night. And one of the innovations that has developed over the last 10 years in the region is really treating those hammocks with insecticides. So that's a very effective malaria control interventions. So I think with the COVID and the kind of impact it has had on disruptions to services, we've seen that civil society organizations have really pivoted and developed alternative models of accessing and reaching these populations as well. And happy to elaborate on that in a little bit.
Thank you. Thank you very much, Amita. Esther, I know you have done some surveys to look at the impact of COVID-19 on TB service delivery. Could you please give us some insights into the impact of COVID-19? Mariam, you may share some slides with our audience.
Thank you, Prof Tang. Yeah, dear all, I would like to share with you the result of, actually this is the initial survey that has been conducted by cross organization, including CSO and also the Ministry of Health. So we conducted the survey to capturing how the implementation of the new protocol of TB during the pandemic. Actually, this survey conducted by, as I already mentioned earlier, conducted by several organizations, including the Ministry of Health Stop TB Partnership, and also my organization, Lembaga Nahdlatul Ulama, who will focus on community involvement, and also a peer support group of TB Indonesia. And the survey conducted by using the Google form and is self-reported. So it covered not only the community, but also the hospital and primary healthcare staff, and also the program TB staff in the district. So there are actually is quite a big survey because we want to capture the field condition currently. But I just want to share with you the highlight of the result. And the first is about the program management. There are some issues under the program management, including the human resources, who now involved also in the COVID-19 task force in the district. So it's more about the 70%. That's why sometimes the staff is overburdened due to the new task for them. And then that's why there is no supervision activities currently, and it's about more than 50% of program staff mentioned about it. And also under the program management, we are concerned about the availability of the PPA, and most of the program TB staff mentioned that they don't have enough stock for the mask until December 2020. But the country already got approval from the Global Fund to provide the mask, the surgical mask for the healthcare provider. And talking about the TB drug stock, and some district mentioned about they are worried about they don't have enough drug stock until December, and also about the laboratory, because most of the hospital and primary health care also provide the COVID-19 services, and also about the community involvement, because currently the country apply the restriction, and so the activity which involve the community is very limited, and that's why the country now try to implement the providing support from the community side by using the digital technology. But yeah, it's still difficulties. There is a difficulty. It cannot cover all the district. And as I already mentioned earlier, we are really concerned about the DRTB services during the pandemic, because uh, currently actually the DRTB patient actually need to come to visit the hospital or primary healthcare every day. But because of pandemic, it's very limited. And here we are really concerned about how to monitor the TB patient adherence. So even here, the hospital mentioned there are about 50% use the digital technology, but it's still not covered all the countries. And the other concern about the no investigation contact activities, and it was mentioned by more than 50% of the hospital. And this is about the primary healthcare services, Puskesmas, and it's a big number of Puskesmas involved in this survey. It's more than 1,000. And again, the concern is about how to monitor the treatment adherence of the patient. Here, I put some number, for example, like using the digital technology only covered by around 75%. And they're using by call the TB patient, but there are still some districts still conduct the direct contact with TB patient, and we are concerned about how to protect them for getting the infection. And also about the community involvement and case finding activities, because no contact investigation activities at red zone now is less than 50%. And also the patient tracing activity is very limited. And also the laboratory, because some Puskesmas cannot provide the diagnosis during the pandemic. And about the community support we got from the DRTB patient, and the concern also about how to visit the hospital and primary health care every day. So, but they said that there's some district still let the patient to come to visit the hospital. And this is for the community cadres activities. So how the community cadres can support the TB patient. And also we are still concerned about no contact investigation and the limitation of using the digital technology. And they still conduct, some districts still let the community cadres to do home visit. So it's about more than 10% of the district. And yeah, we are still concerned about how to protect the social worker to get infected, because the limitation of the availability of surgical masks for them, because the priority is for the healthcare provider. That's the result of the survey. And if we are talking about the impact currently, based on our my organization monitoring result in the 61 district in the country, and our achievement for the new cases finding, no TB cases finding in the second quarter between April to June is only 50% compared to the first quarter of 2020. For the other impact, we don't have any result yet. We still keep monitoring, and I think we can talk later on about it. Thank you, Prof. Tang.
Thank you, ST. It's clearly, COVID-19 has a negative impact on many aspects of national TB control program in Indonesia. Case detection rate declined, the lack of adequate supply of medicines for TB, RD, multi-organism TB patients. But good things we know, we use digital care to continue to provide some services. This is the positive side. So let me invite Dr. Marijke Wijnroks to talk about global perspectives about the impact of COVID-19 on all these diseases.
Thank you very much, Shenglan, and real my pleasure. You might have seen that last week, The Lancet published the results of a modeling exercise of under different scenarios what the excess mortality for AIDS, TB, and malaria could be due to COVID. And it came out over 5 years. HIV mortality could increase 10%, TB 20%, and malaria even 36%, was mostly in high burden countries. And the reasons were mostly associated with decreased access to HIV treatment, lack of diagnosis for TB, and a later initiation of treatment, and disruption in bednet distribution campaigns. And I think it's very consistent with what the previous Amita and ST presented. The Global Fund, we are monitoring levels of disruption at the country level every 2 weeks. We also very soon we advised countries that they could use savings from existing programs to reprogram and spend on COVID responses, not just in responding directly to COVID, for example, buying testing, but also to buy PPE and to adapt programs for HIV, TB, and malaria so that they could continue. And we've been watching very carefully what's happening to the supply chain, because especially initially with lockdowns in China, then followed by lockdowns in India, which are the main suppliers of the generic medicines for treatments. So we've been following very closely. And even though we are a little bit concerned about it, I think it's largely production is getting at so close to previous level. What's now a major barrier for a lot of countries is that especially air freight is much more difficult because there's not that many flights. If I look at what's coming out of the monitoring tool that the Global Fund is using, just globally, we see that disruption is most severe in Sub-Saharan Africa and in Latin America. And I think if you look at where the epidemic COVID is evolving, that makes sense. If you look at the Asian region, I think a lot of countries have been very successful in dealing with COVID, more successful than many other parts of the world, including Europe, and especially the United States. And so what we see that the level of disruption to services is somewhat lower than we see in many other parts of the world. And most countries indicate that disruption levels are low to moderate. If you look at where we see most disruptions, and again, very consistent with what ST and Amita were presenting. For HIV, it's what has been most dramatically impacted is treatment programs and outreach activities, and that specifically will affect the most vulnerable populations, the key population that already have difficulties accessing prevention programs. And in some cases, also the lockdowns and loss of economic opportunities, they increase risk behavior. So prevention, HIV prevention really has been impacted quite badly. I think some countries have found creative ways of dealing with it. A lot of countries, and I think also with ST's your research, it illustrated that digital health, virtual ways of communicating with patients, virtual counseling is something that a lot of countries has adopted. And I think it's going to be something that will stay because it has been a way to effectively communicate with people. And also it is a way, there was one question in the chat, to deal with stigma and discrimination, because that can be done more anonymously. with more confidentiality. And in treatment, a lot of countries have moved to multi-dose, multi-month dispensing. So instead of people having to go back quite often to the health services, they have to go only once every 3 months, or sometimes the medicine is delivered at home, which again is supporting treatment programs, but also helps people to comply and deal with stigma and discrimination. What we see overall, and probably it's also in this region, is TB programs have been affected more severely, and also across the whole continuum of care, from the active case finding. ST showed 62% decline in active case finding. In India, during the first phase of lockdown, we saw 80% decline in active case finding, and that's really worrying, and that will have long-lasting impact, because if you don't find those people with active TB, they will infect other people and will suffer themselves. Also, the TB diagnosis has been impacted because it was crowded out by COVID diagnosis, lab facilities. A lot of staff in TB in TB programs and laboratories, they were moved away to COVID. And in some cases, like for the CEPHI, the gene expert, the same device is used for both the TB and the COVID diagnosis. So we see that TB diagnostics is losing space. And obviously, people with TB, they face a double stigma because there's both the stigma related to TB and there's the stigma related to COVID and people who are coughing. So that's really seriously. I think on the upside, again, here people have moved to more virtual ways, digital health, and even, I think, for the first time for many countries in TB, to move to patient-controlled treatment, where people get their medicines for a month or for 6 weeks, and they have to, for example, check in with a service provider on a daily basis or a weekly basis, but more control by the patient, which again is a positive thing that I hope we will maintain. Malaria, lastly, we saw initially a lot of countries that wanted to discontinue distribution campaigns, which would have had an enormous impact on malaria infections. I think working across the malaria community with technical partners and funders, I think we've been able to work with all countries to adapt the distribution campaign, because mostly distribution campaigns days, a lot of people coming together where the nets are distributed. So a lot of countries have moved to house-to-house campaigns, house-to-house delivery, and with the staff being protected. So most campaigns have been implemented as planned, which is really very important. We've seen some hesitation of, I think, but double. First of all, that people are hesitant to go to the facility with malaria because they're afraid of attracting COVID. So we've seen demand decrease. And also because of the presence of fever and confusion with COVID. So I think the demand side for malaria has definitely suffered. And another element that we've seen is that Abbott, which is one of the important producer of the rapid diagnostic test, they announced a couple of weeks ago that they would shift all their production to the COVID test, and which would have had a dramatic impact on availability of rapid diagnostic tests for malaria. But they've been in discussion with Abbott, and they, at least they will continue producing what they had committed to deliver, and we are working with other producers now to make sure that tests are available. So it's a bit of a mixed picture for the region. Definitely, I think, especially TB, real concerns, but also a lot of innovation happening at the country level to try to continue services. I'll stop there, Shenglan.
Thank you. Thank you. Apparently that there are negative impacts. I'm also glad to hear all these innovative approaches developed to continue the services. So yes, we know these impacts of COVID-19. So how do we mitigate the impact of COVID-19 on TB, HIV, and malaria? So ST, you mentioned, actually, we already touched, you're already developing some innovative approaches to mitigating the negative impact. Tell me more about what Indonesia has done in TB control.
Yeah, thank you, Prof Tang. As Marijke already mentioned that right now in the country, we are in the process to develop of TB COVID proposal, and it was submitted to Global Fund. We use the saving budget of the current program, and in the proposal we already develop some innovative activities such as for TB case finding. We try to develop the virtual active case finding, and actually this activity not only already developed, but we already implemented in the limited areas, and I think it's ready now to be scaled up to another area in the country, especially in the urban area, because in some areas in our country, there is a limitation for using the internet. So, and the other thing for how to build, how to raise the awareness of the communities. And now we try to, we already developed the infographic, and so we use the virtual to keep inform the community support, community social worker, and then we ask them to educate the community not only about the TB and how to also to protect the community for COVID-19. And the other activity, and it's a really new activities, and now we already also developed the mechanism to we call it the community-led monitoring. And this innovative, we developed the application. This is digital application, and it called One Impact. And this application actually not only to let the patient to get knowledge about and information about TB, but it's also to make them involved and give feedback regarding the quality of services, accessibility, and about the affordability, and also stigma and discrimination. And right now it's still implemented in 4 districts in the country, and hopefully after September it can be scaled up to a more larger area. And I think yeah, for as Marijke already mentioned, it the negative impact, it can be long-lasting challenge for our country, and we need to keep intensive monitoring about and ensuring all the activities that we already developed can be implemented and will be effective to keep finding the new TB cases. And the good news, yesterday our president gave a speech in the ministry meeting, and I think it's a very strong point. And he mentioned to keep running the TB program, and he mentioned three key important points. The first is about contact investigation, and he mentioned clearly about it. And the second about multi-sectoral collaboration, and that's why he mentioned about the presidential decree will be available soon, and it will be used to let another ministry in our country to allocate budget for TB. And the third is about diagnosis and treatment, and he called all the stakeholders to pay attention on it, and don't let the TB patient get lost, or we are left behind because of the pandemic. That's all.
Thank you. Thank you very much. That's very important. You have a political will, political support to fighting against the pandemic, right?
Yeah.
So Amita, could you please briefly talk about how the malaria network has done or proposed advocate to them to mitigate the impact, negative impact in particular?
Sure. I think, one of the biggest challenges to the malaria programs, in addition to everything that, everyone else has mentioned today on the panel is, and particularly in the context of malaria and the threat of drug resistance in the greater Mekong, is, the issue of substandard and falsified medicines. So, because of significant disruptions in the global supply chain, there is a gap that's been created in the marketplace with respect to malaria commodities, particularly malaria drugs. And that gap has now unfortunately been quickly filled by manufacturers of low quality medicines, of substandard medicines. And so that is a very big problem, because that could significantly turn the clock back on the progress that we've made on drug resistance. So with respect to that issue, I think one of the ways that we are addressing it is by making sure that we are advocating at the senior political levels within national governments to ensure that national regulatory bodies take appropriate action whenever they find cases of such substandard medicines within their national boundaries. I think there's definitely a case to be made for more collaborative regional action around substandard medicines, particularly in the ASEAN region. So really advocating at those levels. And I think in addition to the senior level advocacy and political commitment that's needed, whether it's around drug quality, whether it's around increased funding for malaria, really matching that with support from the community level. We talked about the role of community organizations and civil society organizations. And just like we mentioned earlier, the fact that a lot of these civil society organizations have been really nimble over the last few months. They've quickly turned around their business models, found new ways of being able to reach communities in need. I think the case of the mass distribution campaigns is an excellent example of how we've been able to really draw from HIV programs, from TB programs, from immunization programs that really followed this model of door-to-door contact, and adapted that for the malaria programs in terms of distributing bed nets. The use of technology, I think, is another really important mitigating factor. In the early days, particularly, the fact that there wasn't a lot of information available around COVID, that really created a lot of fear, anxiety among community health workers, that of course led to creation of stigma as well. And what we've seen is that with the civil society organizations in the greater Mekong, they've used social media channels and use technology effectively to send out a lot of information to dispel a lot of these rumors around COVID, and continue to encourage care seeking for fever, which during the time of COVID has been particularly challenging. The only other thing that I want to mention before I hand over is around the strong need for greater integration of health systems. And I think COVID has really shone a spotlight on that. The fact that disease programs can no longer work in silos. It's no longer about HIV, TB, and malaria, but the fact that we're all coming together at the front lines. It is really about an integrated response. And I want to share the example from Myanmar. One of our civil society organizations shared that. So while in the past they continue to do fever screening, typical delivery of malaria services, diagnostics, treatment, during the pandemic, they also started offering psychosocial counseling, for patients who are affected because of the lockdown and the restrictions. I think it's a brilliant example of how the fact that we have these infrastructures built through HIV, TB programs, and how can we actually repurpose them, for this new normal that we have. Thank you.
Thank you. I totally agree with what you said. In the future, integrated healthcare services are critically important in order to ensure the access of all these services, not just HIV, PDD, or NCDs as well. So before we open to the audience for question and answer, I would like Marijke to tell briefly what kind of coping strategies the Global Fund has developed to meet the challenges, these new challenges.
I think most of the coping, because we're a funding agency, and the best coping strategy we can offer is funding. So we have made funding available right from the start. As I explained before, countries could use savings from existing programs to address COVID. And I think especially in the early days for countries to scale up testing, to scale up availability of PPE, it has been really important. We've in addition made $500 million available a few months ago, quite early in the epidemic, for countries to then further scale up COVID responses and just to make sure that essential health programs continue. I fully agree with the sort of integrated care. I think we've seen that, and the importance of community and civil society engagement. I've seen that, and I've seen that in all countries that it was really difficult to maintain essential services, and so I think all countries have to learn on how because COVID will stay with us for quite a while. It's not going to be over after the first wave, so all we have to find ways of dealing with COVID on top of the other essential health services. I think COVID also has exposed the intersectionality of inequity, because I think if you look at HIV, TB, and malaria, it's they're well-defined vulnerable groups that are very effective. They're very affected by those diseases. It's also the same groups that have, in general, less access to healthcare and will be the most vulnerable to COVID. I think it also has, if you look at in many of the high-income countries, a lot of the focus has been on the hospital-based care. And I think we've also realized that we cannot have successful responses if we ignore the primary care level and the community care level, and that's absolutely essential in early diagnosis, in making sure that there's community support for measures like lockdowns that have been taken, but also that people are informed. In all countries in the world, the lack of the level of misinformation, of really weird theories around COVID, it's really rampant and really hampering effective care. So working through the community level, through the primary healthcare level, is very important to deal with those sort of issues. And I think we've seen a lot of very innovative approaches in engaging communities in primary care levels. And to some extent, I've said from the beginning, there's a lot what high-income countries can learn from low and middle-income countries when it comes to community engagement and focusing on the primary level. Thank you.
Thank you. So now we got 8 minutes. We're happy to open the floor for any questions. For our panelists? Yeah, I understand that dengue is now is a problem in Philippines. I supervised one student from Duke-NUS, and she back to Philippines and got a dengue. So anyone panelists will comments about that?
Just very quickly, I think the question is really around how can we ensure continued malaria, vector-borne disease services, right, and vector-borne disease control. So during the time of pandemic, and I think the short answer to that is the WHO actually has fairly detailed guidance around, how to tailor specific vector control interventions during the pandemic. And the guiding principle they've used is to really follow stratification. So, divide your entire country up into, geographies with high burden, low burden, and make sure that you're prioritizing vector control in those high burden areas. We've already discussed about some of the ways in which we can continue to deliver vector control interventions, like bed net distribution, for instance. So definitely not easy to do mass distribution campaigns, but look at alternatives, whether it's door-to-door distribution, for instance, rather than collecting everyone together in one place. So it's really about prioritizing stratification and then just other alternative models of distribution.
There are many questions coming in. When do TB drug increase mortality rates of COVID-19 patients? SD, you know that? And also there are questions about whether or not the COVID-19 vaccine being developed could help to get rid of the COVID-19 pandemic.
I can take a few, Shenglan, and just mortality rate of HIV. I think the latest data, and it's also, I think we all have to recognize that this is really evolving science, and we know more now than we knew 2 months ago, and hopefully by the end of August we know more again about COVID. So it's our knowledge is really evolving. what we know now about HIV and COVID is that people who are on treatments and virally suppressed are not at high risk of severe COVID. But a lot of people who are older living with HIV, they might have other conditions like high blood pressure, diabetes, and that will expose them to risk, as are people who are not on treatment or are not virally suppressed. So it's a little bit of a mixed picture, but for people who are on treatment and taking up treatment regularly and don't have any other conditions, it doesn't seem to be an increased risk. For TB, what we know at the moment, and ST maybe might want to add to it, is that it's not that the TB drugs increase mortality rate. Because both the COVID and TB affect the lungs, I think we expect that people who are living with TB and have damage, have active TB infection, are at high risk of increased disease, of more severe disease. I haven't seen any hard evidence on it, but I think what's we logically suspect. I think the question on with COVID remaining a pandemic, what's the future like for vulnerable HIV individuals? I think it comes back to we'll have to learn how to live with COVID and how we can respond to sort of flaring ups of the pandemic, and then again it's calming down. So the integrated care that was mentioned before is going to be really important there. But also we should realize that a lot of the systems that have built up around HIV, TB, and malaria are used for COVID: the surveillance systems, the lab system, the trained health workers. So at least we have the basis to work on. And the last thing that I wasn't going to cover, and that's a really difficult one, is it feasible to eradicate COVID through vaccination? I think ideally, if you have a vaccine that protects you from getting the virus, we could eradicate, but we're not there yet. I think so. A vaccine that's 100% effective, that's affordable, that everybody in the world can be vaccinated, we could eradicate. There's a whole lot of research going on for a COVID vaccine. I think the best case that I'm hoping for with the Oxford vaccine, it could be that the vaccine is effective in preventing severe infection, but not necessarily in stopping transmission. But even that would be a big improvement. And there's a lot of candidate vaccines. You might even end up with different vaccines that will be used in different contexts. But I'm not an expert on the matter, that's just from reading my stuff. And maybe ST or Amita can respond to some of the other questions, or Shenglan, because he's an expert.
We know that the vaccine will be available, but as you said, whether or not a vaccine could really prevent the transmission of COVID-19, we are not sure at the moment. Definitely some vaccine developed by Oxford or could protect the people. That's earlier results showing that. It is a published result in Lancet. So ST, if you want to add more, you have 1 minute before we finish.
Okay, thank you, Prof Tang. Yeah, actually, I just want to add the point from Marijke that, as I already mentioned earlier, that now we are still monitor about how the big impact of the pandemic COVID to the TB. But actually, our big concern is about how to ensure about the treatment adherence, because not only about the how the TB patient get infected for the COVID. And I think that's why now the community engagement is a must and really, really need to be strengthened, and how the community can support to provide the support to keep monitoring the TB patient. Thanks, Prof Tang. Over to you.
Thank you. So we actually ran out of time. I think we had a really lively and exciting discussions. We have identified the key impact of COVID-19 on these 3 killer diseases: HIV, AIDS, TB, malaria. And we know the situations, and we also know from the international communities, national governments, the districts have already come up some coping strategies to meet these challenges. We have lots of daunting tasks ahead. we particularly fully aware of increased disparities in access to healthcare for these patients. So thank you very much for our three distinguished panelists. Thank you everybody to participate in this webinar. I think we should wrap up now. Thank you everybody. Bye.
Okay. So on behalf of the SingHealth Duke-NUS Global Health Institute, I'd like to thank all our participants and panelists for this informative session. So do tune in next week again on the 29th of July at 7 p.m. Singapore time for our fifth and final webinar in this series. This will talk about how COVID-19 has impacted non-communicable diseases programs in the ASEAN region. So thank you all once again, and I wish you all a great evening.
Thank you.
Thank you.
Thanks a lot.
Bye.
Bye-bye. Bye-bye.